Now, joining me in studio, I did promise you that this morning we'll be discussing matters water and sanitation. I'm joined by the CAS from that ministry, and that is Winnie Guchu. She's the Chief Administrative Secretary, Ministry of Water, Sanitation and Irrigation. I'm also joined, I'll start with the ladies. I hope you don't mind, Alex. I'm also joined by Dr. Leonita Sumba. She's the former CEO, Water Institute, Kenya Water Institute, and the Chair, Women in Sanitation Association. And Alex, last but definitely not least, Alex Manyasi. He's the Director of Government Relations, Synergy and Coordination of the Water Supply and Sanitation Collaborative Council. Now, if you haven't already registered, we have the Nation Leadership Forum taking place on Monday between 6 p.m. and 9 p.m. at the Taifa Hall of the University of Nairobi. The theme is Sanitation for All. So if you haven't registered, you need to go to nationleadershipforum.com, nationleadershipforum.com for more information, which my panelists will also be providing this morning. The CS, when she joined us, she stressed the sanitation bit of things. Sanitation for all. Why is it important? You talked about water often hijacking the agenda. Why is it important to have this conversation on sanitation?
Thank you very much. And thank you very much for doing the forum on sanitation on Monday. And it is important to talk about sanitation because when you get water, after you use the water gets dirty. It must find somewhere to go. So most of the time we talk about clean drinking water, clean water for, to be supplied and so on. But that water needs to be cleaned after it has been used. So it needs to be collected safely, treated, or even reused. So we want to now emphasize the conversation so that we stop the pollution. We are finding that our waterways are getting a lot of dirt because we are not paying enough attention to what we do with our sewage, what we do with industrial wastewater. And this water, if it's not properly collected, it will find its way to the clean sources of water. So if we want to sustain our water and to make sure that water is clean, we must make sure that the one we use, we collect it and clean it so that it is safely disposed or safely reused. So most of the time you find that people are shy to talk about sanitation because it's considered dirty. Nobody wants to have a conversation around sewage. Nobody wants to have a conversation around toilets. Nobody wants to have a conversation about wastewater. Where does the water go after it's used in industries, after it's used in a slaughterhouse, after it is used in leather industry? Where does that water go? Because it's dirty, it's hard work, it's expensive, people tend to shy away. It's easier to deal with water. It is cheaper, it is faster to install, it is easier to maintain. So you find a lot of time people go for the easier option and then leave sanitation. So what has happened as a result is that we've gotten our rivers very polluted, the sanitation systems are poor, we've been overtaken by events, and therefore we need to rectify. So we've decided to brave it and to decide, okay, this is difficult, but somebody must do it. So that's why we are emphasizing on sanitation.
All right, Alex, I'll come to you. Why do you think it's important to have this conversation around sanitation?
It's interesting asking that question because if you look at even on your TV, you're talking about sewage disposal. Most of the time we confuse sanitation to be equal to sewage, which is not necessarily true. So sewage is just a component of the sanitation part of it. Just like Madam Cieza said, if you think about the more than 84% of Kenyans who have no access to sewerage, then that tells you that the issue of sanitation has to be a discussion. Because all that
and it's interesting that you raised that because in the Bill and Melinda Gates report on how Kenya is doing as far as the development goals are concerned, they say we're not doing too well when it comes to sanitation.
Yeah, and partly we moved away from Millennium Development Goals to Sustainable Development Goals, and what we are focusing on now is thinking about sanitation holistically, thinking about the entire value chain, and thinking about the circular economy. So what that means is that we need to start thinking about sanitation as a value chain from the point of containment to transport, to treatment, to reuse. Just like Madam said, so if you're talking about everything up to reuse, it means we need to focus on looking at sanitation as a business, as a value chain. So once you look at sanitation like that, then it stops being a waste, it stops affecting the waterways like Madam was saying, so that we do not end up in a scenario where, and I know NTV covered extensively on the pollution of Nairobi River, for example. The reason why we end up with that is because human waste is part of the pollutant of the whole water process. And so the discussion around sanitation is a must-have discussion because ultimately, if you think about even the economics of it, if you think about the 28 plus billion shillings we lose per year, if you think about the almost 25,000 kids that we lose per year, if you think about the loss of school time for kids, if you think about stunting
and you say
in
that's
children,
on account of what? What about diseases?
See, that's the disease burden on all these things that I'm mentioning. So the disease burden comes back to haunt us on the sanitation affairs that we have to deal with. So even on our own children, if you think about the kids we lose, the school time lost, the mothers who can't go to work because they have to take care of the children because they're sick, the money that they will have otherwise improved their lives with going into treatment. And then, of course, when you talk about water as for life and sanitation as dignity, then it also comes into security issues. For example, if you talk about informal settlements, if you focus on that, then you're thinking about women and children who cannot venture out there at night to relieve themselves. And so it becomes a security issue. It becomes dignity, like I said. So sanitation has to be looked at from a broader sense. We should not look at sanitation as a toilet, or we should not look at sanitation as a pipe of sewerage, but look at it holistically as something that affects our lives. Okay. And it's good that also cholera showed up in high-end places a while back. So what that also means is that
I don't
all
know
of
if
us,
it's good.
because it kicked off the conversation. It's not good per se, but it kicked off the conversation in the sense that we now realize that all of us are interconnected. So the people who work in our homes, the people who come from the slum areas, are the same people who work in the places where the high-end people go. And so unless we fix that, it has an effect on everyone. So sanitation is so broad, and therefore I'm happy that this discussion is moving away from saying water and sanitation to specifically discussing sanitation matters.
Okay. All right. Dr. Leonita, why is it important to have this conversation around sanitation?
Okay. Thank you very much. In addition to what my colleagues have said, we want to bring everybody on board around this sanitation conversation, and I'll narrow down to the sanitation workers. Do we ever think about where our waste goes when we flush the toilet? Who takes care of it?
In fact, you want to get out of the toilet as fast as
possible. So we are looking at these sanitation workers, sanitation operators, the people who are working in the wastewater treatment facilities, their health, their capacity building. We are looking at even manual emptiers. You know, there are places whereby the exhausters cannot reach, like in the slums. How do we get the waste to be disposed of safely? So it's very important that we bring everybody on this table and talk about sanitation, because it affects all of us. And that's why it's important that we need this leadership forum, so that we show leadership at every level in sanitation management.
Okay. Narendra Modi in India has been celebrated for attaining an ambitious goal of giving almost half of India's 1.3 billion population access to toilets. I know you said it's not just about toilets, but access to toilets in just 5 years. And he declared India free of open defecation. When people relieve themselves in fields, bushes, forests, bodies of water, or any other open spaces rather than use a toilet. You talked about what, 84%?
Yes.
Not having access to
sewerage, formal sewerage.
Formal sewerage.
Yeah.
What do we need to do to remedy that, CAS?
I think we need to think outside the box and not focus directly on one way of solving this problem. I think we need different approaches. And by saying different approaches, you see, like, and I'll focus because you talked about toilets. You find that the toilets that we use, it's usually pit latrines or toilets within the houses. But there are people who actually live in situations where there are no toilets, in the urban areas and in the rural areas. And we need to focus differently on how to provide these toilets, or have a provision of how people can be able to access toilets safely. Like Alex mentioned, that toilets can actually be a security problem. If you don't have access within your compound, within the household setting, it's very, in particular because of girls, it's very unsafe. So what we need to do is to approach it differently. We need to think about how do we do toilets that are accessible, that are cheap, and that, you know, that also water is a problem in some of the places, and even using dry toilets. So there are many methods that have been applied. So there are toilets that don't necessarily use water.
What's a dry? Okay, how does that work?
It works because the toilet is built in such a way that the urine and the dry matter does not mix. The reason why toilets smell is because the urine and the dry matter mixes. That's what attracts flies. That's what makes the toilet smell. So there is technology, and Alex are already working on it. They separate the urine from the fecal matter. So the urine goes into a container, and the fecal matter goes to another container. And when they finish, they just pour sawdust on it. If you go into that toilet, it has no smell at all. There are no flies at all. And this toilet, the waste is collected every 2 days. That's what they are doing. So you find that where there is scarcity of water, the toilets can still be maintained because they're not flushing the toilets all the time. So we need to look at the different strategies that we need to apply in different areas. Now those work very well in informal settlements where there is no space to put up toilets, where people are sharing the facility and people are trained to use that properly. The other thing that has really become a problem is the sewer. How we do the sewer lines, the traditional sewer line, is expensive. And you find in places like Brazil, for instance, they are doing things called condominials, which the sewer lines are shallower. They are not as deep as the ordinary sewer. The pipes are smaller, and you find manholes even going into people's houses. So you find that that sewer line is community run, and not necessarily run by the county government or being constructed by national government. All the county government does and national government is provide standards, rules and regulations on how to run those condominiums. The other thing is that we need to decentralize the sewer systems. Right now, if you just look at Nairobi, all the sewer lines all the sewer lines are directed towards Ruai. Now, you find that there are people in private sector also doing this work. So we need to decentralize. How do we decentralize? We can introduce the use of biodigesters so that that fecal matter does not need to be piped and taken to one central place. So that's what we mean by decentralizing. So that I treat my waste in my compound, and when whatever I discharge, I'm discharging already treated and clean water back into the waterways, so that we remove the burden of doing this. We also, to be able to do this, we also need to invite private sector. So as government, we need to make it feasible and to make, like what they are saying, make sanitation work be business, because it's big money. There are a lot of, she talked about manual emptiers. Those are self-employed people, and they're providing a service that is needed to a very great extent. Because like she said, some places, a vehicle, even a mkokoteni cannot access. So it's a human being to access carrying those buckets to go and empty. Those are people providing businesses. What we need to do is to enable those people, give them proper training and give them proper medical facilities so that they're protected. So private sector, exhausters, for example.
So there's a lot of opportunity for
there's
the private
a
sector
lot
to come
of
in and partner
business
with government.
opportunities in the sanitation program. So why we're having this conversation is to open up ourselves so that we are able to see that there is an opportunity out there. Let's convert this waste to something more useful. Let us provide employment, because there's a lot of employment. If you consider every day, everybody is making something dirty. That's a very big opportunity. There's a lot of solid waste, there's a lot of fecal waste, there's a lot of water waste. From the minute we wake up, we are using something that is ending up being waste. So instead of calling it waste and saying it's dirty, we need to transform our minds and this is from the head, we need to transform our minds and to be able to see this as an opportunity and convert this dirt into something more useful.
More useful.
So we need to be more innovative and think really outside the box and have this conversation, because there are people with great ideas. They've just never had the opportunity to voice them. So that's why we are happy we're having this forum, so that people can start bringing out new ideas on how to do things, so that we are able to fast track and be able to resolve our sanitation challenges.
Okay. And for your contribution, as I said, you can register at the nationleadershipforum.com. It's going to be at the Taifa Hall of the University of Nairobi between 6 and 9 p.m. On Monday. Now, Alex, she's brought up the dry toilets and biodigesters. And did you say condominials?
Condominials, yes.
Yeah. First of all, tell me, where are these dry toilets presently being used?
So the dry toilets are currently in the informal settlements, especially of Nairobi, the larger Mkuru, Mathare, Viwandani, and the larger area of that side of town. So that's where they majorly are. Just like Madam said, the reason why it works in those specific places is because of the reason that somebody referred to, which is access. Those places are densely populated, all of us know. I'm happy that she actually physically visited there and to see, because you see,
I want to go in and see for myself.
Yes, it will be good to actually go and see exactly how those places look like. Then once you have seen, then you can appreciate why technology, in terms of looking at what works, is key to even service provision. So if you think about even how we got here, is because prior to this census, for example, that just happened, informal settlements were not even being considered in planning. So because of that, we created a scenario where people were living in places and we didn't plan for them. We didn't think about what services they need, and therefore some of them are living on land that is contentious, and therefore the issue of land tenure is an issue. So if you look at it like that, then the technology that works in those places has to be specific to what is feasible. Now, the reason why that is also a good technology that works in there is because, one, it allows access, first of all, the services that people require. And then secondly, it's also in line with SDG 6.2, which is looking at safely managed sanitation. So you have to think about access to the toilet, which in this case, for example, in that specific example, is a dry toilet. You have to look at the transportation aspect of it. Where does that waste go? You have to separate it from the people. And then is that waste being treated and being treated properly? And then beyond that, then how do you reuse the byproducts that come out of it? So looking at that, the challenges also that we have brought, of course, we devolved this country into 47 different counties. And by having that, we moved money to 47 different places of Kenya. And what we have now done is that anywhere you take money to, you create interest for people to follow the money. And therefore, the 47 counties, what we need to do, and that's why this conversation is key, is that the 47 centers of money are going to be the 47 centers where people want to move and live. And that is already being seen across the country. So this discussion is key, like I said, because we need to continuously start thinking and ensuring that the sanitation aspect of these people is actually catered for, so that we don't end up with where Nairobi found itself. Because you see, this city initially was actually planned for about 300,000 people, the infrastructure that we have. So that is the infrastructure that we are hoping to build on, which is extremely complex, it's extremely expensive. And at some point, I keep saying that unless we think outside the box, like Madam said, then we might not be able to serve the people that we ought to be serving. And beyond that, as a country, everything that we do, we have to lace it with, does it provide employment? Does it create value for Kenyans? Kenya, for example, is a water scarce country. So even as we think about providing people with water, we need to keep at the back of our minds that we are already water scarce, and therefore everything must be done to conserve the little that we have. And unless we do that, then we are already, of course, creating a crisis for ourselves in future. So the thinking is there. We're happy that the government is taking lead. Mama Safia, she's referred to in the ministry. She's taking lead on that, and that's great because government leadership is everything. Private sector will look at the commitment of government. I sit in many, even in global discussions around matter sanitation, and even development partners will tell you for sure that they want to see how organized government is. They want to see the leadership of government to even think about putting resources into the sector. So I'm happy that government is actually taking leadership on that, and that is an impetus for ensuring that the other players who are supposed to come in to help the sector grow are actually beginning to come in. And I'm sure she can attest to that. The discussion is now becoming more frequent. Other sector players are becoming more interested. And of course, I know, and I'm sure that we'll fix it.
All right. Now, Mama Safi spoke about condominial technology, which is being used in Brazil. Will that provide a solution to, when you're walking around Nairobi and it's rained a little bit and then sewage starts overflowing, is this a possible solution to that?
Yeah, so it has worked in Brazil. I was in Tanzania, and there's some town that has also worked in Tanzania. And so remember that all these things are workable, but we have to also remember that different countries will look at these technologies, and different technologies will fit in specific different places. Okay. So not everything works everywhere. Like, for example, we are talking about Mukuru and others. If you go to Kibera, you might require something slightly different. So yes, they can work. However, again, unfortunately, sanitation is not a one ministry or one person thing. Because you see, like you're saying, the issue of clogging anytime it rains. You see, that's a drainage issue. And therefore, every person who is involved in whatever way has to be involved in the thinking. So that as you think about providing sanitation, you think beyond that. Because even that clogging that you're talking about, the water table in Nairobi is very high. If you look at the areas like Mukuru, for instance, the water table is high, and therefore, when it rains, if you're putting any pit latrine in Mukuru today, the day it rains is the day it overflows. So we have to think beyond. Every different area that we serve has to be thought about differently, so that the different technologies can be applied in different places, okay, so that we get the desired result. So I must admit it's complex, but a lot of research has been done. A lot of trials have been done. The government, like I said, is in the driving seat, and you'll get there.
Okay. Right. Dr. Sumba,
yes,
you are the chair, Association of Women in Sanitation, correct?
Yeah, women in water and sanitation.
Why women in water and sanitation?
Yes, that's a good question. Why women in water and sanitation? As we all know, women are closely linked with water and hygiene issues and sanitation issues in the home. Yeah, we play a major role in fetching the water, in cooking, in ensuring that there's enough water for us to bath. So why women in water and sanitation? It's because we've looked at it and said the women need to be empowered at all levels, starting from the lowest level, to be empowered, to be able to provide these solutions. Think about the Pampers. Think about the sanitary towels. They are clogging our sewer system. So what are the alternatives to disposing of these kinds of things? Yeah? Look at the water sector. We don't have so many women, but we have a number of women in various institutions. So can they take up the lead role and come up with the influencing policy that will lead to the women making decisions that affect them? So that's why women in water. So we are going out to capacity build these women and tell them you can make it, you can make a difference wherever you are in a society, at whichever level.
Okay.
Yes.
All right. Sanitation, of course, is a big issue for very many people. You said it's a dirty, people are not too comfortable discussing matters, sanitation. So who are the stakeholders we're bringing on board at the Nation Leadership Forum, Madam CAS?
I think we want to, our first and primary people that we want to target at the Leadership Forum are members of the public. Because I think we cannot succeed without the support of citizens. They are the people who make decisions on how to sustain, first of all, to promote cleanliness, and because water is perceived differently by different people. If you ask Manyasi what sanitation means to him, he sees it from a man's angle. If you ask me what sanitation means, it means something totally different to him. Because we are involved in sanitation in different ways. For example, who takes care if somebody is ill and they have to be cleaned? Whose role is it? If somebody is not able to use the toilet, whose role is it? If somebody needs to go to hospital, whose role is it? If the house needs to be cleaned, whose role is it? If the car is dirty, whose role is it? If you're selling water, whose role is it? So we all see water and sanitation differently. And to be able to address these problems, we need to understand the different angles that people are seeing sanitation and water. From where do they see it? So that we are able to sensitize. You talked about clogging of sewers. We assume it's automatic, that people know how to use sewer lines. It's not obvious. We do not have sometimes places to dispose solid waste. So some people see a manhole as a way of disposing. So you find somebody opening a manhole and throwing solid waste in there, and it clogs. So sometimes it is us as citizens who make the clogs happen because we don't understand how to use sewer systems. You find some people don't know that in a toilet, that you don't throw solids in a toilet, even if it is a pit latrine. So you find that in a pit latrine, a bulb that, a bulb has blown, it is thrown in the pit latrine. Clothes are torn, pit latrine. You want to go to the loo, pit latrine. So you find that it's very difficult to manage that solid waste when it goes to a pit latrine. So one of the things that we want to do in the forum is a means of starting to create awareness on how to use sanitation facilities properly. We assume that we know. And so we do not provide that education. So, in the sanitation forum that finished 2 weeks ago, the president actually gave a directive that sanitation be part of the curriculum. And Ministry of Education is now working on making this sanitation topic an education issue so that people learn at a very early age, because we've assumed that people know. So the forum is one way of creating awareness to the public. Number two is to be able to bring stakeholders, different stakeholders, that is private sector, different levels of government, because we have different functions. County government has its functions, and county governments have been very supportive in this sanitation issue, so that we are able to understand what is the role, people understand, what is the role of the county government? What is the role of national government
yes,
with regards to sanitation? Many times sanitation is thought about washing hands and provision of water. But we need to see what roles do county governments, national government play with regards to providing sanitation services. Sanitation services is at the county level, but government, national government does what? It does the infrastructure to make sure that the big investments are done so that county government takes over and it provides the services to people. Private sector, what opportunities are there in private sector? What legislation do we need? So we'll also have members of parliament represented. In particular, the committee that deals with environment, matters of water and sanitation. What sort of legislation, regulations, laws do we need? Are the laws in place outdated? We have new challenges because of the new situation. With regards to also technology, we want to invite people who are key in technology to show us what sort of technology can we apply with regards to sanitation. Students, what are their needs? We'll have university students in that forum. do they have curriculum that caters and addresses sanitation issues? Are they trained well enough to be able to provide the services that we need with regards to sanitation? Tertiary and technical colleges, what sort of education are we providing to be able to deal with the demand in the market with regards to sanitation? So basically the forum is one for us to be able to explore what are the opportunities and what are the relevant opportunities, because we'll hear a lot of stuff, but what is relevant where? Like Alex said, that not everything, you can't have one size fit all. Different methods will have to be applied in different places.
Yes.
And I just want to go back to the condominiums that I talked about. And you're asking, will they work? The reason why they work is because they are managed by communities. And the minute you involve a community, all the way from identifying the pathway of those condominiums, to them managing, to them participating in the construction, and for them to be able to understand how to maintain, because our biggest problem is maintenance. You put in the investment, we need to have maintenance. If the community has invested in that project, they will be responsible for making sure.
Have that sense of ownership.
To have the sense of ownership and to want to maintain it. And that's where condominiums have worked, is because the communities have taken up the role. So they need to be trained, and they participate in the process of doing the infrastructure and maintaining the infrastructure. And most importantly, knowing how to use the condominium system.
I thank you for answering the question on the difference between what it is that the national government is responsible for and what the county governments are responsible for as far as sanitation is concerned. Apart from Brazil, you mentioned Tanzania. What other jurisdictions can we borrow from? What has worked for other people that we can that may work for us?
So there are many, and one of them, Madam, has already mentioned the condominiums. Of course, the normal sewer lines have also worked in many places, depending on the countries as well. Dry toilets, like we mentioned, have also been used in different jurisdictions, depending on the needs that they have. So I guess, and of course, the biggest chunk of sanitation provision facilities used is pit latrines. But even when we talk about pit latrines, it also depends. In the informal settlements, for example, like in Nairobi, like I said, the water table is high. So how do you ensure that the pit latrine anywhere is not also polluting the underground water? Because we are also depending on underground water largely, even in Nairobi, there's some of that. In rural areas, you'll find a lot of people have dug pit latrines, but if you look at the way they are placed, nobody has guided them to look at ensuring that the shallow wells that they use are not at a gradient lower than, lower than where the toilet is.
Because so what happens then?
Yes, so we keep getting cholera and getting people sick because of the way they have even positioned where the toilets are. So there's a lot of work to be done. Like I said,
does it seeps into the water?
Yes, it does. And so especially the shallow wells, they are dangerous because the water literally mixes up with the waste from the pit latrines. And so education is also key to ensuring that people understand why, when we are saying this, it's also important. And if you look at the way we have even subdivided our land, for example, it's gotten to a point where some people have no control over what the immediate neighbor is doing. If they're going to put a toilet and your shallow water well is just at the lower end and you have no control over that person. So you see, there are so many things that are required. How do we ensure, for example, that the pits are lined? Because if the pits were lined, then it would be easy for the seepage to be controlled. So as a country, this conversation, that's why I say this conversation is good, because one, we are offering knowledge out there. The Leader Forum is meant to also come and offer that kind of information to the publics. But having said that, also just ensuring that the different entities of government that Madam is talking about are actually taking their rightful positions in ensuring that the citizenry is actually protected. If you look at our hospitals today, and that influences the way we should be looking at things. Almost 60% of the people in hospitals today should not be in hospital. they are suffering from diseases that are actually preventable. Most of them sanitation related. So anytime we look at it like that, then we need to put our investments in places where we have the most impact on our citizens. When we have a healthier citizenry, then we end up...
And we have a more productive citizen.
Exactly. And that is what we should be looking at mostly, ensuring that we have a healthy nation. But beyond that, we are engaging our citizens in activities that actually make money. So we shouldn't have, and I'm happy that even the government is also coming up with the sustainable waste management policy also that looks at ensuring that there will be 0 dump sites in Kenya. What that means also is that to ensure that we are not throwing anything that should not be, that can be recycled. So as a country and thinking about the circular economy, we need to think about ensuring that everything that we think is waste, which has value, actually ends up back into the value chain. And that way we will create employment. We will ensure that our citizens have something to do. When we create employment, of course I'm going into the economics of it, then we ensure that people have something in their pockets. That means we increase their purchasing power and we increase their quality of life. So these things have to be thought about holistically, and when government, like I said, is in the driving seat, our role is to ensure that we support government to actually achieve exactly that. Okay. Ultimately, this country belongs to all of us, and it's in the interest of all of us that everybody else is actually served by the services that we offer.
Okay, so the crux of it is that sanitation is not something we can afford to ignore. You know, it'll take pressure off our health systems, boost our GDP because more people,
yes.
Well, you know, it creates employment opportunities, business opportunities, and also a more productive nation. Dr. Sumba, what are some of the simple things we can do in our homes to push this agenda forward? I read somewhere that you can put in a bottle of water into your cistern and you use less water when you flush. Are there other tips like that you can give us?
For sanitation?
Or even for water, to conserve water. He talked about Kenya being water scarce. What are some of the small adjustments we can make in our lives, in our homes, to improve the situation, make the situation better for everybody?
Like for water, we can use small assistance, yes, to save tips. Like water, I still go on water because that's what I know now. When you're brushing your teeth, you make sure the water is not running. Like doing what, using push taps, yeah, installing shower heads that can save on water. Yes, and then in the homes with regard to sanitation, I think we can also adopt the dry sanitation.
I'm not too sure about
yes. And this is because we've been asking ourselves the right questions at this time. We are saying, must waste go to waste? So the waste, the fecal matter, is fertilizer. So if we can adopt those toilets, then we can use that on our crops. Let me trees, fruit
human
trees.
fecal matter.
Yes.
That sounds gross.
There are many things. There are many things to sanitation.
Yes.
For example, if I can just jump in there, if you look at, I keep asking myself, time and again, if you went to Lenana School, and I keep using that example, the school that I went to, which has 1,600 students, why will a school like that not be using the waste to actually, because they have almost 300 acres of land, why should they not be using, composting that waste and using it in the farms? That's number one. Yeah. Secondly, the amount of water they use to flush toilets is unimaginable. You can't imagine how a school like that, in terms of the bills that they use. Thirdly, you could even use biocenters in a school like that to do lighting and to do cooking. Why will a school like that, for example, be dependent on power, on electricity? That water that they use, that waste that goes to waste that we keep flushing all over the place. Like Madam said, why should a school like that not be doing everything on site? That is a school that can be self-sufficient in everything. You will cut costs at the end of the day. What that will do is also, it will cut cost on the school in terms of the amount of money they use to run the school. And therefore, that means even school fees will reduce. That's a national school. And therefore, the kids that come from the poor backgrounds cannot afford schools like those because of school fees. So we must be innovative. When a school has that amount of land and that population, it means also the usage can actually be driven down by more than 50%. When you do that, you grow your own food, you will have your own chicken. I'm saying that because I was fortunate to have gone to a good school where those things are provided. But how do we ensure that that school can actually benefit a poor boy from a rural area in this country so that they can go to that school and afford the school fees? So that's how we need to think as a country, so that we are not ending up with institutions that are taking up a lot of money, which is not necessary at the end of the day.
Okay.
Okay, I want to make it a bit more, because we've not reached that stage. You can see the reaction that you're coming up with when you hear that fecal matter can be used as fertilizer.
Yes.
But that's what fertilizer is made of, actually. But it is made safely. But just to give an example, there is a school actually that is doing this whole recycling thing. We've done a documentary. It's in Gigiri. Now this school gets water, and even in Nairobi University here, you find that they're reusing their water. What happens is that they have two tanks. There is the tank that receives water from county government, from the water companies, the cleaned water. It goes to a particular tank. Then the water goes and is used. The water that is used in the bathrooms, the water that is used inside the kitchens, so the shower line and the kitchen line is pushed to a cleaning area. And the cleaning area is a small space, you know. I mean, it's a small space that is converted. So all that used water goes in at Nairobi University to a room inside the basement, and all the water from the toilet goes in, and it all goes and it's cleaned. Now that water, after it's cleaned, goes into another tank. This water that goes now, the grey water, is now used to flush toilets. And it is reused 5 times before it is used to wash cars or for irrigation. In this school also, that's what they are doing. They are cleaning the water, and the water is actually potable. I actually drank that water.
The clean
Inside,
water.
yes. The water comes in from sewer, and it comes out on the other side as clean drinking water.
You took your life in your hands.
I drank the water. Nothing happened to me. They are not using it for drinking. And I'm not saying we do it drastic. But I did it to check whether I'm going to get sick or not. But I drank the water. Nothing happened to me. Meaning that actually there are systems that are being applied here in Kenya that are cleaning that water. So in that school, they're not drinking the water yet, because we really need to change our mindset also. So what are they doing with that water? They're recycling it to flush toilets. They're using it to plant trees. They're creating a forest because of the 10% coverage.
Yes.
Their kids in that school are planting trees, and that's the water they're using to water those trees. So what we are saying, like Nairobi University is doing, and like the school is doing, the fecal matter, let's use it to grow trees. Since we are not yet ready we are not psychologically ready, and we are not prepared enough to say that we use it for manure for food. So that I'll say, let's wait a little bit. We have a lot of homework to do so that we are able to train people that it needs to be treated before it can be used as fertilizer. And there is a process. So that now we are managing the process. The other thing is that I want to just touch on the rural sanitation, because we seem a lot of time to focus on urban sanitation. Now rural sanitation, we are now decentralized because we have county governments. We have 47 county governments. So what we are doing really is creating 47 Nairobis. Because we have, and I want to thank the Treasury Planning Ministry for the census. They put in questions there on sanitation, and they put in questions on water. And the fact that we can see how population is shifting, we now need to focus on rural areas. Population is really growing, although it's not growing as much as we intended. But if you look at the land is getting smaller and smaller and smaller and smaller. And we have the culture of inheritance. So what happens is that what my grandfather owned was maybe 2 acres of land. Then he got 5 sons. Then he subdivided for the sons to inherit. And therefore, where there was only 1 pit latrine, there's now 6 pit latrines. Because each son, when they build, they put in their toilet.
Yeah.
Then the sons get children also. So what was 1 acre is now getting into smaller chunks.
Yeah.
So these 2 acres, in the next 100 years, will be full of little pit latrines all over the place. You see what I mean? And what happens is that a pit latrine, it soaks down the liquid waste. So what happens in that area, there's a concentration of a lot of fecal matter and urine on the ground. And the pressure will become too much on the ground to be able to clean that waste, and all the water that goes into the soil finds its way back to the waterway, because when it goes through the soil, hits the rock, then on the rock it slides down to a waterway. So what happens if we don't manage the rural sanitation properly is that all the water that's going to be disposed into the river is going to be contaminated. So then do we need to start rethinking, in the next 30 years, is pit latrine going to be a solution? That's one big question we need to look at. And that answer will be given because now, one of the challenges that we've been having is we've been saying we don't have data. Now the census is going to provide us with the data. And therefore, we are able to plan 30 years from now what's going to happen. And we must be able to focus and see that the problems of sanitation today are going to be very different 30 years from now. And therefore, rural sanitation needs a different approach from the pit latrine if we are able for us to be able to conserve the environment. So again, we need to go back to the drawing board and see whether there's a question you asked about other technologies. There's the decentralized treatment facility, which is a small, it sits on less than half an acre, and all the cleaning works happens underground. So there's no smell, you don't see anything. All the fecal matter, all the sewage, wastewater goes in there and it's cleaned. And it goes into chambers and comes out as clean water. There is no smell, you can't tell that there's a sewage plant cleaning sewage or wastewater. So that will be something that we'll need to adopt for perhaps small populations in the villages so that they're able to channel their waste into those decentralized facilities so that we stop contaminating the ground.
Okay. Dr. Sumba, I'll let you have the absolute last word.
Yeah.
What is it that, sometimes you sit back and think about and say, if I had audience with the CAS, then this is what I would tell. This is some of, or rather, these are some of the recommendations I would propose to her. I'm giving you audience now with the CAS. Have the last word on this subject.
Recommendation to the CAS or the CS?
The government.
The government.
She's representing government.
Okay. I'll have to. We adopt the decentralized wastewater treatment facilities, especially for the rural areas and the unserved areas. And number 2, we look at the sanitation workers, especially those who are working in the wastewater treatment systems. I'm informed that when you you are on a disciplinary case, you're taken to work in the sanitation, in the wastewater treatment facility. And you see, we want to raise the profile of this sanitation. So if you are going to use it as a punishment, then it should not be, people will not want to study sanitation. I'm from Kenya Water Institute, so I'm about the curriculum, about people coming and studying sanitation and knowing how to manage wastewater properly. So let us also look at the welfare of the sanitation
workers.
Workers.
All right. Thank you so much.